Hey guys, just wanted to pop on and do another video for you for this week. I think the topic is a bit more straightforward than our previous ones. I'm just going to go through the nursing role and some of the considerations that you might have for oral administration of medications. So the key thing really when you're giving meds is you need to know what you're giving. Okay, you need to know what the therapeutic effects are, and you need to be able to look for these in your clients. So if you don't know a medication, that's okay. Do you know how many medications are out there? There's a lot. There's a list of common ones in our syllabus, in the NRC workbook. And so I would recommend you take a look at those. And as you see them or come across them this semester in your practicum, in the sim lab, you're making cue cards as you go. That's going to help you get to know the meds, understand what those therapeutic effects are, and it's just going to get you familiar with the process of thinking about the effect that that med is going to have on your patient. So the other thing you can do is if you are in your practicum or clinical and you don't know a med, you can always go and look it up. And I know that even practicing nurses at times will encounter really common meds on their floor, but then there's the odd time that they have a med that they just don't know, and you go and you look it up so that you can effectively administer that medication. Okay. The other thing to consider when you think about what the therapeutic effect of that med is do you need any other assessment data to be able to safely give that med? So if it's a medication that's going to impact things like blood pressure or pulse, have you done a recent set of vitals that you can then consider as part of giving that med? Okay. The other thing that you need to do as a nurse is you need to consider what you know about the patient and whether or not it's safe to administer that medication. So for example, if your patient has been experiencing diarrhea for the past 12 to 24 hours and it's becoming very bothersome to them, you may not give the stool softener in the morning because the effect of the stool softener has begun to work, and now you're having the opposite problem, right? So you have to use your clinical judgment when you're thinking about giving meds. Okay. You have to also think about safety in terms of their ability to take a med. So particularly when we're thinking about the oral route, people need to be able to swallow. They need to be able to hold the meds. They need to be able to manipulate them in their mouth and then swallow them down. So you have to think about the person's ability to be able to do that. Okay. So can they swallow a whole pill? Do they need that pill to be crushed? Or if they are having difficulties with swallowing, is there a liquid form of the medication that could be given? Okay, so you need to think about all of that. And you don't just give a pill because that's what's ordered if you think that there's a safety risk involved with that patient taking that pill. The other thing to consider is the patient's mental status. Sometimes they may experience things like confusion, okay? And that might actually impact their ability now to take that pill. So previously, yesterday, they weren't having any issues with confusion and they were able to swallow that oral pill, but now you have concerns about that. So you have to think about that as a factor that could impact whether or not you can administer a medication orally. Okay. The other thing to think about with your client is, do they know why they're taking the medication that they're on? Okay, so a lot of patients are used to just getting a lot of pills in a cup each morning, and a lot of nurses may not actually ask the patient whether or not they understand what each pill is for. They have a right to know what each of the medications are that they're taking. They also have the right to refuse to take any of their medications. So you need to make sure that they are aware of what each of them are for and how those will affect them. Okay. The other thing is you need to look for different side effects when you administer medications. Okay, and we need to document those. And the other thing that we need to document is if a patient says, I'm not feeling well, I can't take this medication right now. That's not their lack of compliance to taking the medication. It's the fact that there's something going on with them at that point. So what we would want to do there is look for things that are going to impact nausea and vomiting and maybe administer something like that. And then perhaps in a little bit when they're feeling better, we can then re-administer the medications that they were supposed to have. If that happens, you need to document appropriately. And if they aren't able to take the medication that is ordered, you need to notify the primary care physician. So that is a lot about sort of the nursing role. The other thing to really consider is just that you need to know your rights, your medication rights. And so this is something that you're going to need to practice a lot, and you're going to need to sort of memorize what those are. And so the more that you practice, the better you're going to be at using those to administer meds. A couple of other things just to sort of go over, looking at some of the responses on the quizzes, would be that you need to assess the functional status of your client to consider if they need help with administration, okay? Some meds may need to be crushed before you administer them if they can't swallow, okay? And if you aren't sure if a med can be crushed or not, you need to be checking with the pharmacy, okay? Sometimes there's the liquid substitute that can happen, and sometimes a capsule might be a sustained release capsule, in which period the drug is released over a period of time, so you can't actually crush that medication. So you need to always be checking with pharmacy if you're unsure about any of that. Okay. The other thing is if you are looking at your physician's order and one of them is unlegible, okay, rather than going to pharmacy in terms of that, you actually have to go back to the provider that wrote the order and check and confirm what it was that they actually wrote, okay, because if you can't read them, you need to clarify with the person who wrote it, okay. And the other thing I want to point out is sublingual tabs aren't designed to be swallowed. So they're not designed to come in contact with the acids that are in your stomach. They're designed to be absorbed through the vessels under the surface of the tongue. So again, you would need to, if you're teaching your client about that, you're telling them that they aren't designed to be, and that the route that they're made to be administered is under that tongue. Okay, great. So that's everything on oral medications. Bedside assessment was another topic for this week. You guys have learned about this previously, so I'm not going to do a lot of detail here, but this is the quick scan of what's going on with my client, right? What are their priority areas, and where are things that I might need to go and do a more in-depth analysis? So this is really a systematic way of doing your analysis and your assessments on a client that then pulls out sort of where you need to go from there. You should be able to do it in less than 10 minutes, okay? And it should be done at the beginning of each shift, and then as the patient's acuity changes or their condition changes, or even just if your nursing judgment tells you that something seems to be off with them, okay? This is a really essential skill that you must have moving forward. You're going to be practicing it each week in simulation lab, and that's really when it comes down to that assessment in sim lab in weeks at the end of the term. You're going to be asked to be showing your ability to do this. So practice, practice, practice this skill. Okay, well, have a great week, everyone.